Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone?
Securities market.
Hello everyone, happy evening. A quick note whether I'm audible and visible, everyone. हाँ कार्तिक एकदम बढ़िया होप तमाम भी बढ़िया सुठो लॻियो सिंधी ॿुधी करे nice. Okay, so happy evening everyone, a very good evening. I hope and I believe all of you are doing well. And so here we are to discuss the next set of the Fast 5 quiz, which has some really interesting questions today. And this is the discussion of the Fast 5 quiz, which was conducted on 4th April 24. You can find it in the app, the Medsynapse app. Right, so we have daily Fast 5 quizzes which are happening in the app and which are available to be taken only over the course of that 24 hours. Okay. Right. So before we start with the discussion, there are some quick updates and very important announcements that I want to make before we start with the discussion. And that is first of all, so we are starting with the short INICT live short. Right. So instead of doing it offline, we are doing it online for everybody, so that it's easy for everybody to join in for the short class. So what's the plan here? Basically, I've been receiving a lot of queries for that, and this is not just for INICT students. There's an echo. Let me just check. So we are starting with the short INICT live short, right? So instead of doing Is it any better now? The echo is gone now. Fine. Okay. All right. So yeah, so there's a big announcement about the INICT short or the binge revision happening live in app in the format of both live and recorded videos that we have. And let me clarify this, that this is not just only for the INICT appearing students. It is going to be for the students who are appearing for NEET PG also, and the FMGE students also should be joining in. So what is the plan here? Starting from tomorrow, basically, see, we already have the short 5.0 in the app, which is available as a recorded class, the offline class recording. Okay? Or usme, what you have to do is by this month end, you have to finish off the entire short 5.0, because then from 27th April, we'll be building upon that content. We'll be adding on extra topics. We'll be revising the most important topics from here, which are very important for upcoming INICT exam. So I don't want anybody of you to think that what is this something new which is being discussed. That's why the first thing that you have to do is to complete the short 5.0 from the app. How much is the duration of this short 5.0? It is approximately 44 hours that we have. That is 18 subjects that we have. So I've given you the target. So follow this target and try to complete the short 5.0 from the app. So the first one is 13th. मतलब कल से आप start करना. This is your short 5.0 target from the app, the recorded video to be finished. So PSM, psychiatry, pharmac, anesthesia, physiology, that's how I've given you one subject a day. And if you look at the duration of the subject, 3 hours to 3.5 hours is what is the big subject duration, and the short subject duration is 1 to 2 hours is what we have, right? But trust me, this is definitely going to help you basically boost your scores and boost your ranks, no matter whatever other resources you have used so far. Do not be afraid of using a new resource now, because this is all just consolidation with all the tricks and mnemonics that we have here in the Short 5.0. तो आप रोज इसमें बेसिकली एक सब्जेक्ट देखोगे. So starting from tomorrow, that is 13th April, you'll complete this by 30th of April. There are 18 days, 18 subjects that you'll be completing. Now, if you are wondering what are these subjects which are given in red, so we also have the inicet PYQ marathon which is going on, in which we have completed 9 subjects, right? And 9 subjects are remaining. So the plan is basically we'll also be completing this inicet PYQ marathon by 30th of April. We are planning to complete this. Okay, so we are trying to basically get the test in app. So for example, tomorrow you will have both ENT and PSM inicet previous AIIMS 2015 2016 questions being discussed. So we will have ENT discussion in app live at 12 p.m. and PSM discussion in app live at 6:30 p.m. So for the rest of the 9 subjects, like you are giving a test for the Fast 5, I'll be putting up the PYQ test in your inicet PYQ test series karke ek test series hai which is available. The test is going to be available for everyone, but the discussion will be available only for the in-app subscribers. That is going to happen in app, and this is the timetable for completing the rest of the 9 subjects that we have remaining here in the inicet PYQ test. So the subjects which are given in red are the one is basically where the inicet PYQ discussion has been already done for these subjects. For the subjects which are remaining, I've given you the target in such a way that when you attend the PYQ test and its discussion, you complete the short at least of that subject, if not the entire subject revision. So for example, you'll be doing PSM in the first half for today, tomorrow, and then you'll be appearing for the PSM test somewhere in afternoon, and we will be discussing the questions of that at 6:30 p.m. So tomorrow we'll be learning a lot of tricks in biostats, the PSM numericals. A lot of that has been asked in the past. So we are going to learn a lot of that tomorrow. Okay, so give the test. ENT test will be live by tonight and the PSM test will be live by tomorrow morning. Okay, and then when you will read on 18th medicine, for 19th you will have the medicine PYQ test, pathology ke baad pathology, pediatrics ke baad pediatrics. That is how the sequence is going to be for the subjects which are remaining. So by 30th April, the target is to complete the Short 5.0 for you to finish watching that, and for me to finish the inicet PYQ, all the subjects which are remaining so far. Okay, that's the plan. Yes, Vivan, that's the plan. And we are now coming to the inicet Short live. This is first part that is happening from 27th of April to 14th of May. All the 18 subjects have made a timetable for you where we are going to do basically the binge revision of these subjects, right? The last minute revision, the binge revision before the subject, topics that you cannot afford to make wrong. We are going to handpick those topics. There'll be some topics over and above Short 5.0 that we will discuss in the respective subjects depending on the recent PYQs, the recent PYTs. Okay. Yes, Naveen, I'll send you a notification in app and also on Telegram when the test is live. Okay, for ENT test, for PSM test, and for the other subjects also. ठीक है, इनका duration मत पूछो, right? So it is not duration bound anything. It is all about completing the important topics, and this is very important for the NEET PG and FMG students also. So all the students who have joined the app recently and have been asking me that how should we proceed with the app content, start with this timetable, right? And attend these classes and alongside do the PYQs of FMG also is what is the plan. Okay, this is the plan that we have. And this is the duration I've shown you for short subject, how much duration you have for each subject. Like you have to do PSM tomorrow. It is approximately 3 hours. If possible, finish off ENT today. Approximately 2 hours you can do ENT today itself, so that you can give the ENT test after watching the short, right? You can apply those mnemonics that you are learning. Okay. Now, for the students who are following the timetable, this timetable that we had, which is finishing on 16th of April, right? In the next 3 days, this timetable is finishing. So the plan for you after that is, this is what you have to do in the remaining days. I've given you the plan for the next 5 days, 17 April to 21 April. If you're giving INICT, right, then you have to finish all the PYQs in those 5 days. Quickly revise the PYQs of all the subjects. As you are solving the PYQs, do it like a test, and whatever topics you think that, oh, I don't remember this, or I've forgotten this, I am not able to recollect this, I'm making a mistake in this topic, write down the list of those topics, so that in the next phase from 22nd April, फिर आपका जो next आएगा revision cycle, उसमें you'll be focusing only on those topics to be revised again and again. So first, now that you have done one cycle of revision, first complete all the INICT PYQs. I've given you that on which day, what subject should be done, right? So in the 5 days, try completing all the PYQs from whatever resource you have used. Okay. Parth. So for INICT PYQ, for remaining subjects, there will be an in-app test like the Fast 5 test that we are doing, and we'll be doing a live discussion. The timetable that I've shown you is basically for the live discussion that will happen on these days. The test will go live 1 day prior night mein ya in the morning mein. We will have the discussions in the evening. We will have the INICT PYQ discussions in the evening at around 6:30 p.m. Okay, clear with everyone? So this is the plan that I've given you, and now finally coming to the questions discussion. I hope everybody is happy with the plan that I've given you. Sure shot is the most important, the crux for your any exam, be it FMGE, NEET PG, INICT. Then you add on the PYQ marathon, and then from 27 April, we'll start the short shot live, the binge revision before your INICT exam, and we'll complete by 14th of May. Okay, that's the plan that we have. Leaderboard kiske liye nahi hai, miracles? No leaderboard for what? And yes, in the starting with the list that I showed you, basically these are the top rankers of our Fast 5. 4.424 वाला जो quiz था, these are the top rankers that we had. Congratulations, Vishnu, Limbu, I don't know ये कोई nickname लग रहा है, Ayush, Ramshad and Shiva. So congratulations on being there in the top 5. Now getting ahead with the discussion of the questions here. Okay, so start with discussing these questions. These questions today are very, very interesting. Okay, very, very interesting clinical conceptual questions is what we have. So the question is lengthy question. I always start reading from the last line. Which of the following is the most likely diagnosis? Next, I'm reading the second last line. A biopsy shows cells scattered predominantly along the perivascular spaces, right? And it is given that this is a patient with AIDS who has come with history of memory loss. So HIV patient, AIDS with dementia, with movement disorders, clumsiness, right, and memory loss, you start thinking of the dementia or the HIV encephalopathy is what we have here. The next point that we have here is MRI shows diffuse, poorly defined bilateral hyperintensities within the white matter, right? So this is a diagnosis of HIV encephalopathy. What are you seeing in the image here? What are you seeing in the image here? So basically the image is showing the multinucleate giant cells is what you are seeing, which is a finding which is seen in HIV encephalopathy. Okay, which is HIV encephalopathy. So remember that what is the image showing is basically the multinucleate giant cells is what we are seeing in HIV encephalopathy. Is this clear with everyone? So the diagnosis is HIV encephalopathy in cryptosporidiosis. Cryptosporidium is what causes diarrhea in a HIV positive patient. That history will be there. Diarrhea in HIV positive patient. There's no memory loss, dementia wala feature here. HIV protease inhibitors. Remember, protease inhibitors cause lipodystrophy as a predominant side effect there with protease inhibitors. Lymphoma, that you would see a lymphoma in a HIV positive patient is mostly a solitary lesion, right? The primary CNS lymphoma, and it can, in the HIV positive patient, it can come as a ring enhancing lesion. It will not come as bilateral hyperintensities within the cerebral white matter. Is this clear with everyone? If it would have been ध्वनि, अगर HSV encephalitis पे कभी भी question आता है, so they tell you the temporal lobe being affected. Here it is white matter affected bilaterally. So the important point also to remember here that when in a HIV positive patient on MRI you see bilateral white matter lesions, the two important diagnoses that you think of are the conditions which is HIV encephalopathy, hive, or you think of progressive multifocal leukoencephalopathy, that is PML. Leukoencephalopathy tells you that it affects the white matter. Okay? Out of that, HIV is more so bilateral symmetrical and this is more so asymmetrical. PML is more so asymmetrical and it is associated with the JC virus. Okay, it is associated with the JC virus. Is this clear with everyone? Is the voice clear or not clear, guys? Someone is saying कि voice clear नहीं है. Is the voice clear? Is it any better now? Yes. Right. So is this clear with everyone that why the diagnosis is HIV encephalopathy? Right. You have in HIV encephalopathy, you have memory loss, you have motor symptoms, and you have bilateral white matter lesions that you would see which are symmetrical. Okay. Okay. Very good. Going on to the next question. A 4-year-old boy has a viral URTI for the past 3 days. The clearance of the virus is dependent on which of the following? What do you think is the answer to this one? Clearance of the virus is dependent on which of the following? Yes. What will be the answer to this? The question is on the virus clearance. Okay, the question is on the virus clearance, right? So remember that the virus clearance, basically we are talking about cytotoxic T cells. Okay, we are talking about cytotoxic T cells which kill the viruses, the viral infected cells by inducing those perforins and granzymes. Cytotoxic is your CD8 positive T cell. So that is going to be what MHC restriction? For 8, it is MHC 1 restricted. Rule of 8 is what we have. 1 8s are 8 and 2 4s are 8. So basically you will have the CD4 will be your MHC2 restricted, CD8 will be MHC1 restricted. So this is going to be class 1 MHC viral peptide complex presentation to the cytotoxic T cell. It is not going to be your class 2 because class 2 is for CD4 helper cells. Okay, it is for CD4 helper cells. And what do the helper cells do? Why are the helper cells called as helper cells? Because they help the B lymphocytes to form the antibodies. Okay, they help the B lymphocytes to form the antibodies. Those are the helper cells that we have there. Activation of macrophages, it what leads to the, it activates the formation of granuloma like you see in TB वगैरह में जहाँ में ये लगता है. Phagocytosis of the viral particles is not done by the CD8 plus T lymphocytes. It is done by the antigen presenting cells. So a quick snippet from the first aid like we have in the fast 5 quizzes. So T cells are the cell mediated immunity. B cells are the humoral immunity. You have CD4 positive T cells which are the helper B cells. They help the B cells to make the antibodies and they produce the cytokines to recruit the phagocytes and activate other WBCs. The CD8 positive, which are the cytotoxic, they eat the cells. They directly kill the virus infected and the tumor cells via perforin and granzymes, similar to the natural killer cells. Is this clear with everyone? These are the ones which are responsible for type 4 hypersensitivity. Remember, the type 4 hypersensitivity is cell mediated. There's no antibody there. This is what is responsible for your organ rejection, the acute and the chronic. The hyperacute organ rejection, transplant rejection is by the preformed antibodies, which is type 2 hypersensitivity reaction. While your acute and chronic, there's a role of the T cells. Rule of 8, MHC2 is CD4 and MHC1 is CD8. So the answer is going to be your class 1 MHC viral peptide complex presentation, because this is what is cytotoxic. So it will eat the virus wala cell by inducing those perforins and granzymes, and that is why the answer is class 1 MHC. Is this clear with everyone? Immunology is important for your NICT exam, right? Very, very important. Okay? So that was the second question. Going on to the next one, right? Another very, very conceptual question. What do you think will be the answer to this one? Yes, so this is the PV loop, the pressure volume loop for the left ventricle that has been given, and the question is that the person has been given nitroprusside. Okay, a person, if a healthy person is given nitroprusside and the reflexes are blocked, which of the following labeled end systolic pressure point is most likely? So what do you need to understand here is, right, the correct answer is D and not A, right? So let's try to understand this. Nitroprusside, I would recommend watching the PV loop ka video, basically in the main videos of the Medsynapse app in physiology section. Very, very important, right? The Wiggers diagram and the PV loop is something that you should watch from the main video in physiology, especially for your NICT exam. नहीं, ये YouTube पे हो रहा है, ठीक है? Right, so what do you have here is nitroprusside में क्या होता है? Nitroprusside is a vasodilator. I hope all of you remember that. It releases the nitric oxide. Nitric oxide increases the cyclic GMP, and that is how it causes vasodilatation. It causes arterial dilatation more than the venous dilatation. So by causing the arterial dilatation, what is it doing? It is decreasing the afterload. Okay, it is decreasing the afterload against which the heart has to contract and pump. So what will happen if the afterload is decreased? What will happen to the heart contractility? The heart contractility will increase. The cardiac contractility will increase. So what will happen to the end systolic volume, guys? So when you have a decreased afterload, what will happen to the cardiac contractility? There will be increased cardiac contractility. And when there is increased cardiac contractility, what will happen to the end systolic volume? Yes, MedLife, I teach all subjects there except for radiology. Radiology is on prep ladder. Okay? So the end systolic volume will decrease. Why? Because the ejection fraction has increased. क्योंकि afterload नहीं है तो ये बहुत ज़्यादा pump करेगा heart. So end systolic volume will decrease. What point tells me the end systolic volume here in this PV loop? This is the end diastolic volume, right? And this is the end systolic volume. So the end systolic volume will decrease. That means the graph will shift to left side. So what points will we have here? What points are we ruling out? A, B और C तो नहीं होगा, E होगा या D होगा, क्योंकि end systolic volume कम हो रहा है. Next, because the afterload is decreasing, the pressure that is generated, the pressure that is required to pump against that decreased afterload will be less. So the left ventricle pressure will be less as compared to the normal, right? So the answer is going to be D, because the pressure is decreasing. When the afterload decreases, what happens to the LV pressure? The LV pressure required to pump the blood will decrease. That means the PV loop will be shortened. Okay, the PV loop will be shortened. When the end systolic volume is decreased, the PV loop is shifting to left. Okay, it shifts to left. Is this clear with everyone, guys? Got the concept here? So this is very logical and conceptual. You'll be able to answer this only if you understand the concept of the PV loop. And that's why you should be watching this video from the app in the main videos. Physiology section mein PV loop and Wiggers diagram. Okay, very important. So because nitroprusside is arterial dilator, the afterload decreases. So the contractility increases and you will have the decreased end systolic volume. The pressure required is less, and that is why it is getting shortened, and that is why the answer is D here. Is this clear with everyone? Right? A very, very good question, I would say, which actually tests your concept and application of the PV loop. All right. Going on to the next question here. A really lengthy question. Look at the options. This is the first thing actually that you should be doing in your grand test, in your final exams. कोई भी question आप देखो, सबसे पहले देखो कि options क्या है. उससे आपको आइडिया आएगा कि ये कौन से टॉपिक से रिलेटेड क्वेश्चन है. So Shadiac Higashi, chronic granulomatous, all of this. So this is something related to immunodeficiency disorders. Again, please watch it from the main videos. I've covered the immunodeficiency disorders in the easiest way. You will get it in pathology and microbiology main videos. Okay. So yeah, is it Shadiac Higashi? Is it chronic granulomatous or the other? Let's try to have a look at this one. Now, the last line, which of the following is most likely diagnosis, axillary mass, the culture shows staph aureus. जब मेरा immunodeficiency disorder का question है and the staph aureus is mentioned, that basically means, remember the mnemonic from microbiology, Staffy cat. We have a cat named Staffy. So cat is catalase positive is Staffy, staph aureus. So this tells me that this is catalase positive infection, and I start thinking in terms of chronic granulomatous disease. Let us try to look at the other clues here. What do you have here? A nitro blue tetrazolium test shows deficient reduction. Again, the major clue that the respiratory burst is affected here. The NADPH oxidase is affected, and that is why the answer is the chronic granulomatous disease. Two things which are given here. The nitro blue tetrazolium, there is no reduction. That means there is no color change from yellow to blue. Okay, it is not changing to blue because there is no NADPH which is required here. And the second, which is staph aureus infection, which is catalase positive, is chronic granulomatous disease. Yes, very good, Ankit. That is dihydrorhodamine flow cytometry test. NBT test is what is done for the chronic granulomatous disease. So let us quickly have a look at this snippet from the first aid book here. Chronic granulomatous disease and Shadiac Higashi. We tend to get confused here. The rest of the disorders I've discussed in the main videos in the app. Remember that Shadiac Higashi, HIG, is basically high number of granules that you would see in Shadiac Higashi. And this is a very, very important image here where you see the high number of granules in a cell. It is Shadiac Higashi. Why are they granules here? Because the trafficking is affected. The lysosomal trafficking LYST gene is affected here. Remember, this is autosomal recessive. There is microtubule dysfunction. Because the granules are affected, it affects the multiple cells, like it affects the nerve cells, right? The melanocytes. There is neuropathy. There are multiple things that we see here in Shadiac Higashi. Albinism is an important finding here. Giant granules, high granules is what we see. There is pancytopenia and mild coagulation defects is what we see here. Okay? Chronic granulomatous disease on the other hand, remember chronic granulomas, यानी chronic वाले infection हो रहा है, जो acute response है in bacterial infection that is affected. That means the respiratory burst in the neutrophils is affected, and that is your respiration is oxidation. So remember the NADPH oxidase is defective here. So these have increased susceptibility to catalase positive organisms, which are Staph aureus, which is nocardia, which is generally given in the question. Staph aureus, nocardia, Burkholderia, these are commonly given in the question, even Candida or Aspergillus. Okay? Here the dihydrorhodamine test is abnormal, and the nitro blue tetrazolium dye test is also abnormal. It fails to turn blue because for this NADPH is required, which is absent here. Okay. So remember, it does not turn blue, it remains yellow. The nitro blue does not become blue basically. Okay. So this is your chronic granulomatous disease. Remember, you don't have the granules here. You have high granules in Shadiac Higashi. The granuloma tells you there's chronic infection jaisa, acute infection response is affected. Respiratory burst is affected here. Catalase positive organisms, and you have NBT, the color wale test, which is affected here. Okay? Is this clear with everyone? Right? Is this clear with everyone? So remember, for chronic granulomatous disease, the C and the C is, this is catalase positive infections, and you have the color test like dihydrorhodamine and nitro blue tetrazolium test. Okay, this is the major clue here. All right, clear with everyone? Immunodeficiency disorders is important. Okay, it is important, very, very important. So this is about your question here. Okay, clear with everyone? Going on to the last question here, again a very, very lengthy question here, and but from a very important topic, the disorders of sex development, the DSD is what is the question based on. What is the major clue in this question here to help you answer this question here? The major clue here is there is increased concentration of LH, FSH, testosterone, and even dihydrotestosterone. There is increased dihydrotestosterone. So remember that in a male, the active form of testosterone is dihydrotestosterone, and that is what is required for the development of the external genitalia. So if the dihydrotestosterone is not able to act, then it will lead to the female external genitalia even if there is testis in a male. So let us have a look at these options one by one. Decreased 21 alpha hydroxylase activity. We read this in congenital adrenal hyperplasia का most common cause है. I hope you remember the mnemonic here. 21, that is 1 at one's place. 1 at one's place basically is related to virilization in a female child. We will see virilization in a female child. That is the most common history there. In a male child, it's going to be precocious puberty. If there is decreased 5-alpha reductase, what does 5-alpha reductase do? It converts testosterone to dihydrotestosterone. So this will be defective. If this is defective, the dihydrotestosterone levels will be less and not increased, unlike this question. So this is also out. Failure of testis to secrete the anti-Mullerian hormone. So testis generally secretes anti-Mullerian hormone so that the Mullerian duct, the female tract, does not develop. The uterus does not develop, right? What are we seeing here? There is ultrasonography, there is no uterus or fallopian tubes. That means the anti-Mullerian hormone was present, and that is why there is no uterus here. If there is failure, there will be a small uterus will be present, which is not present here. So even this is out. The answer is defective androgen receptor. This is like a resistance, right? When there is insulin resistance, the insulin levels increase. When there is a nephrogenic diabetes insipidus, kidney resistant to ADH, ADH levels increase. And when there is your androgen resistance here, that is because the receptor is not responding, the dihydrotestosterone levels will increase, right? So very, very important, the increased dihydrotestosterone levels are present, but they are not able to act, is your clue here for defective androgen receptor. And that is why, because the dihydrotestosterone is not able to act, remember the male external genitalia will not develop. So even if it's a male, the testis is there, but there will be ambiguous genitalia. And that is why the question mentions that this is a girl, because phenotypically, externally, it's a female genitalia that we see, right? So it's a female, it's a girl. There is bilateral inguinal hernias, shallow vagina that ends blindly, right? And apart from that, you see that the gonads are found during the repair of the hernia. That means inguinal swelling jab bhi denge, it is undescended testis that they are talking about. So there is testis which is present, which is already given, and the karyotype is 46XY. Is this clear with everyone? Dhwani, kya nahi samjha? So let's have a look at the snippet, the disorders of sex development, 46XX, 46XY, and ovotesticular, right? When there is ovo and testis both together, that is called as a true hermaphrodite. Okay, that is what is a true hermaphrodite, when you have ovotestis, ovary and testis both together. When it is 46XX, the ovaries are present, but the external genitalia are virilized, very common cause, congenital adrenal hyperplasia. Okay, a girl with virilization, congenital adrenal hyperplasia. 46XY, that is testis, but externally it is feminized. right? The most common is the androgen insensitivity, that is defective androgen receptor, because the dihydrotestosterone is not able to act, and therefore there are no male external genitalia, right? So when you have a male with ambiguous genitalia, female genitalia external, androgen insensitivity. When you have a female with virilization, congenital adrenal hyperplasia is what you should be thinking about. Okay? Is this clear with everyone? Got the concept here? So these are the 5 questions that we have today. Let us quickly revise this. What did we learn today? First was HIV encephalopathy, right? HIV encephalopathy, high bilateral white matter is affected. That is multinucleate giant cells. Memory loss, clumsiness is what you would see here. Second was for virus clearance, cytotoxic cells, natural killer cells are required, cytotoxic CD8 positive. So they will require MHC1. Third question was based on nitroprusside effect on the PV loop and systolic volume and systolic pressure pe kya hoga? So because it is nitroprusside is an arterial dilator predominantly, it will decrease the afterload. So what will happen? The ejection fraction will increase. So this end systolic volume will decrease. The pressure will decrease because the afterload is less. Next one, when you have Staph aureus infection, nitro blue not able to reduce, it is chronic granulomatous disease. NADPH oxidase deficiency is what we have here. Catalase and color test is what we have in chronic granulomatous disease. Next one, when you have a male child, right, but who is externally looking like a female, but internally there are testes, androgen insensitivity syndrome, you will see increased dihydrotestosterone levels that will be mentioned. The dihydrotestosterone levels are high is what will be mentioned here. Here the female will not be able to menstruate, there will be no menses because this is continuous increase in your hormones. It is not like a cyclical increase, plus the uterus is absent here. Okay. So those were the fast 5 questions for today, and everyone get on to your next phase of revision. All the subscribers on the Medsynapse app, start your short 5.0 revision. Very, very important, right? For everybody, whether you are giving INICT, NEET PG, FMGE, let's all of us follow this timetable so that we are completing the short by this month end. And by this month end, like I said, we are completing the INICT PYQ marathon also. And from 27 April, we'll start the binge revision of the subjects, the INICT, the short happening live in app for the subscribers. This is going to be useful for NEET PG and FMG students also, because we'll be re-revising the most important topics from all subjects in the live sessions. Okay, so that's the plan that we have. Thank you so much everyone for joining in, and I hope you're finding this fast 5 sessions useful. Do not forget to give the test in app when they are live. There's a link for the test in the description of this video also. Right, and you can, there's a playlist of the fast 5 quiz discussion on this YouTube channel. You can check that playlist. All the fast 5 quiz discussions have been added in the playlist itself. Okay, so you can check that. The PDF will be attached to the test itself. Okay, so I'm attaching the PDF to the test in the test series after the discussion, and you can watch the video on the YouTube channel as well. Okay, thank you so much everyone. KBMD's मेरा class है ना? So sometimes for the INICT PYQ we'll be doing a KBMD, and sometimes we'll be doing a test. You'll anyways get a leaderboard. Even if you give a test, you will get the leaderboard. When you are doing KBMDs, you get a live leaderboard in class. So anyways, in both of these, you are going to get a leaderboard. Okay. All right. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, and keep winning. Do not forget to give the ENT test and the PSM test. We'll be discussing both of those tomorrow, 12 p.m. ENT and 6:30 p.m. PSM for the app subscribers. The INICT AIIMS PYQs is what we are going to discuss. Okay.